Good afternoon, everybody. We're going to start approximately on time. The Health and Wellness Committee sponsors a series of late life planning presentations. This is the second, captioned Hospice. Hospice is a service that when we need it is available through Deerfield. Two different services. The most frequently used is Four Seasons Hospice and Macon, Thoma, MBA, RN, CHBN is the, well, I always have that problem too, and I try to cut it down to reasonable. She probably has a couple more, but we don't have time. So Macon, Thoma will make the presentation. If we have questions, follow up with questions, interrupt with questions, and if half an hour after the presentation you have questions, Macon is here most days of the week, and if you forget her contact information, just drop a note to Dave Eckhart and I'll restore contact with you. So here's Macon to spend upwards of an hour with us.
Thank you all. Appreciate being here. I want to start by just figuring out my audience. So who here has had a loved one receive hospice care in the past? It's pretty impressive. Okay. Who here has had a positive experience with hospice in the past? Anyone here have a negative experience with hospice in the past? Okay. So there's always room for growth, right? So we'll head out. We'll start with what hospice care is. The technical definition, according to Medicare, is a specialized medical service provided to patients near the end of life with comfort as the primary goal. It is primarily provided wherever the patient calls home. The part that I find important is that we say that it's about making the most of your time and focusing on your quality of life. Hospice is supposed to be about living the best life that you have left, not about dying. Dying is a very small part of what hospice does. So you qualify for hospice care when you have a life expectancy of 6 months and you're no longer pursuing aggressive life-extending treatment. Basically, you have to be at a point where a physician looks at you and says, in my best medical judgment, I think that if this person's disease progresses at an average rate, their life expectancy is less than 6 months. Deerfield really screws that up. Okay, the care here is so good that 6 month thing is at best a guesstimate, and it is very common for folks at Deerfield to spend a lot longer than 6 months on hospice care, often years. The average length of hospice admission here is about 7 months. And that includes the folks who, come on just in their last couple of days of life, come out of the hospital after a, life-altering event, and just want to come back to Deerfield for their last days, all the way up to the people who I've had on my caseload for 5 years. Hospice is a choice that you make to have hospice services. And once you sign up for hospice, if at some point you decide you don't want them anymore, it's very easy to revoke your hospice benefits and remove yourself from hospice care. It's one piece of paper to sign. The other thing is that if at any point while you're on hospice, you stabilize or you improve to the point that your life expectancy really looks like it's longer than 6 months, then Medicare is going to tell us that we have to discharge you. The technical term is discharge. At Deerfield, I call it graduating from hospice. And it's not uncommon for people at Deerfield to graduate. And then when things change again and they start to have more decline and they meet the criteria again, they might come back to us. All right, what's next? Full disclosure, guys, I looked at this PowerPoint as I was kind of fiddling with it yesterday, but it's been a while. So these slides are going to be kind of as much of a surprise to me as they are to you. So I'm going to be reading along. The question of hospice care accelerating people's deaths. I think a lot of people feel like if they go on hospice, it means they're going to die faster. And actually, the statistics show that people tend to live longer on hospice than without hospice care. Turns out that when you're in a lot of pain or you're really struggling to breathe or you have other uncontrolled symptoms, that burns a lot of energy and wears people out faster. So if we can get you comfortable, you might live for longer. The stated goal of hospice is neither to prolong life or hasten death, but to maximize the quality of life for whatever time our patients have left. And that is quality of life by your definition. It doesn't matter what I think quality of life is. For each of my patients, I'm going to ask them what their priorities are. So I might have one patient that I see who says, I don't care if I sleep all day, I don't want to have any pain. That's their priority. That's quality of life for them. Okay. I might have another patient who says, I can live with some pain. I want to be as alert as I can for as long as I can to interact with my family. Okay. That's my marching orders. For some people, quality of life is completely unrelated to symptoms at all. It might be a project that they want to be able to complete. They want to be able to focus on. And so we're doing everything we can in the background to help them accomplish those goals. And we might be doing some symptom management in the midst of that, but that's not their priority. And our priorities are based on your priorities. The rest of your life, the healthcare system, their job is to tell you what to do. Hospice is supposed to be about our patients telling us what's important and us responding to that. Ooh, I got a thumbs up. I like that. All right, so we have a few myths about hospice that we'll cover. The first one is that hospice care means we're giving up. It does not mean giving up. It means making sure that the time that we have left is spent on what matters the most to that person. It shifts the focus from just trying to stay alive for as long as possible to being able to do the things that are most important to you. Another myth, hospice is only for people who have a few days left to live. Like I said, Deerfield blows that one out of the water. One of the things we hear most often from families of particularly patients outside of the Deerfield community is that they wish they'd called hospice in sooner. And calling hospice as soon as the provider has indicated that somebody meets the criteria and has a 6-month life expectancy helps us get to know people before those final days and get to know priorities and be able to already have a relationship before we get to that point. And that's ideal. All right, next question. Will I have to stop all of my medications? Not usually, no. I mean, if you have chemotherapy drugs or things like that, then that would be considered life-prolonging treatment and probably wouldn't be appropriate for someone who's choosing hospice care. But for the most part, the medications that you're taking, you're going to continue taking. Your blood pressure drugs, your, whatever medications you're taking for chronic diseases. Now, one thing that does happen when you go on hospice is that it's a good opportunity for the doctors to reevaluate your medications and see if maybe you're on some that you don't need anymore, that were more appropriate in the early stages of disease process and aren't doing any good anymore. We often find that to be the case, but going on hospice doesn't mean that we're not going to treat people. Doesn't mean not taking antibiotics. If you get an infection and you want antibiotics, you take the antibiotics. It just means we're focused on quality of life, not extending life. All right, what should I expect from hospice care? When you go on hospice care, the admitting nurse, and often at Deerfield, that will be me, although sometimes it's one of my colleagues, will come and talk to you about what your priorities are, what's important to you, and help set up a plan of care that honors your goals. And, we talked about that's going to be specific to each individual. We're not going to make your goals for you. You get to make those. And calling hospice earlier means more time to put that plan in place that, takes those wishes into account. What matters most to you matters most to us. It's my favorite thing about doing hospice work. I got to be honest. I was a terrible hospital nurse because I was supposed to tell people what to do all day, and that doesn't come naturally. All right, next myth. Hospice is a place. Hospice is definitely not a place. It's a specialized medical service provided to patients near the end of life with comfort as the primary goal. It's primarily provided wherever the patient calls home. So at Deerfield, we have patients in all levels of care. We have patients in independent living, assisted living, and skilled nursing. And if somebody moves from one level of care to another one, I follow them. We do have a place for hospice. The Elizabeth House is the Four Seasons hospice facility. It's essentially the hospice hospital. So if we have someone whose symptoms we can't get managed at home, instead of sending them to the emergency room, we can use the Elizabeth House as a hospital facility to treat those symptoms and get onto a good medication regimen that will then allow you to go back home, wherever home is. All right, who provides hospice care? Every hospice patient has a team of hospice professionals working with them. There's a provider. Dr. Mike Marschke is the hospice physician who makes visits at Deerfield. He's a consultant, so he doesn't become your primary care physician, but he's available to consult for symptom management needs that come up. A nurse case manager. That's me. I am the eyes and ears of the doctor, helping to coordinate care and make sure that the medication side, the medical side of things is going as it should and meeting the patient's needs. We have CNAs, nursing assistants, who can come in and help a couple of times a week with somebody getting a shower or a bed bath, or can help train family members on how to provide hygiene care at home. We have social workers who come in and do extra psychosocial support. Deerfield has the most wonderful social workers anywhere. Our social workers are just a little added bonus on top of that. Extra resource to be available to support our patients and their family members. We have chaplains who are an added benefit on top of the Deerfield chaplains, who are also wonderful. And our chaplains are trained in all different, they're trained like hospital chaplains in all different spiritual backgrounds so that they can minister to our patients from whatever spirituality that patient practices. We have music therapists who are amazing and do symptom management using music. It's one of the neatest things I ever get to see. I've seen Autumn come in and help regulate someone's heart rate and blood pressure using music. I've seen her help families connect with a loved one who has such advanced dementia that they have been nonverbal for years, and Autumn can find the music from their childhood that has them singing along with their family. I've seen some really beautiful things from our music therapists. And then we have volunteers available for companionship and support with other projects that might come up. We are available 24 hours a day, 7 days a week. So if you have some sort of a need after hours, you just call. We have nurses, social workers, chaplains, doctors who work around the clock and are available for whatever is needed. Another myth, that hospice will provide caregivers around the clock in my home. Unfortunately, we can't do that. We do not place caregivers in the home. So if you need around the clock care here at Deerfield, that would mean either, utilizing skilled nursing or assisted living, or paying for your own private duty caregivers in the home. We're available for things that might come up, but we don't provide hands-on care around the clock. How do I get hospice care? Hospice care comes with a physician's referral. So you ask your doctor whether you or your loved one meets the eligibility criteria for hospice. You can also call hospice directly if you want to talk about it, but it does require a physician's referral to get into our care. How is hospice care covered? There are hospice benefits with all healthcare coverage that you can get. Medicare, Medicaid, VA, private insurance, they all have a hospice benefit. And then if we run into someone who does not have any sort of healthcare coverage, Four Seasons is a nonprofit, and we have a foundation that will provide support to cover hospice care for anyone who needs it. All right. Did you know we support people's goals, wishes, and desires to do whatever within reason they're capable of? Here's a statistic. People live an average of 29 days longer in hospice care than alternative forms of end-of-life care. And accepting a referral to hospice simply means you've chosen to focus on quality of life for however much time people have left. And the trite little saying that they always use is, we do not focus on the number of days one has left in their life, but instead we focus on adding life to those days. It's true, though. All right, what diseases do we treat? Any life-limiting illness that leads to a prognosis of less than 6 months. I think most people think of cancer when they think of hospice. That's not the number one disease that we treat. Other illnesses that might lead to hospice referral: heart disease, lung disease, dementia, stroke, liver and kidney disease. Cancer fits in there somewhere, but anything life-limiting, Parkinson's, MLS, ALS, you name it, we got it. All right, another myth. Hospice is just going to give me morphine and that's going to make me die faster. Anyone ever heard that one before? Yeah, okay. We do use morphine. We love morphine. It's not the only med we use, but it's good for a lot of different stuff. It helps with pain. It helps with anxiety. It helps with shortness of breath. It decreases how hard your heart has to work. And we can access it in a form that someone doesn't have to be able to swallow, that it can absorb through the lining of your mouth straight into the bloodstream. So yes, it's a medication that we use a lot. We're never going to use it in a quantity that's going to shorten someone's life. Our motto is start low and go slow. And so if we do administer morphine or another opioid, it's just going to be to control the symptom. And often we find that people whose symptoms are managed using medications like that have enough energy to live a little bit longer than they otherwise would. Another myth: hospice can help me end my life. That is definitely a myth. That is not legal, especially in the state of North Carolina, and I look terrible in prison orange. So we cannot help our patients accelerate their death. Seriously, orange it's not my color. We can support patients who have decided they no longer want to fight to extend their lives in any way. So we can help maximize comfort for people who have made that choice, but we cannot help to accelerate things. How does hospice support my loved ones after my death? We have a grief services department, a very robust grief services department that will offer support to family members for a year after our patients' deaths. Reaching out and offering different forms of support, groups, individual one-on-one sessions, whatever might be helpful. We have the Compass program for children and adolescents experiencing loss. We have a camp for kids who are experiencing grief. And this is a free service supported by our foundation for anyone in the community, not just folks who have lost loved ones in Four Seasons Hospice Care, but for anyone in the community who needs that bereavement support. How does the hospice team, now we're going to move sort of more into the Deerfield side of things. How does hospice work with Deerfield? We work together. That's what it comes down to. I've been in this role working as the embedded hospice nurse at Deerfield for 12 years now. And my role came about because Deerfield wasn't utilizing hospice very much. And when the hospice asked why that was, the response from Deerfield was, our residents feel like they should have everything they need provided to them here on campus. They shouldn't need an outside service. So the solution was to make it an inside service. So I became embedded here and became a part of the Deerfield team, even though I don't work for Deerfield. I'm here 5 days a week. The other members of the team are here multiple days every week. And I'm meeting with the providers here on campus. I'm meeting with the Deerfield nurses and social workers daily to make sure that we are all coordinating care. For patients in skilled nursing or assisted living, the Deerfield staff remain the primary caregivers, with me as an extra resource for them and the rest of our team as an extra resource. We add an extra layer of support with availability of professionals who are experts in symptom management for patients approaching end of life. So it doesn't change what Deerfield's doing for you, it just adds on top of that. Does the hospice doctor become my primary doctor? Short answer is no. The referral to hospice is initiated by your primary doctor, or it can be a specialist. You can get a referral to hospice from your cardiologist or from your oncologist or any other ologist that you see regularly who thinks it's appropriate. At that point, your attending physician remains your attending physician unless you choose to have a hospice physician take over as your attending physician. We report in to your attending physician, and our doctors are available to consult. There's an unrelated caveat that I always like to cover there because I know the question is going to come up. There's always the question of, well, what if I go to skilled nursing? And that's not a hospice question. That's a Deerfield question. Most doctors in the community, when one of their patients goes into a skilled nursing facility, they're unable to make the regulatory visits required by Medicare in a skilled nursing facility, and so they will therefore turn their patient over to the doctor in that facility. So that's unrelated to hospice, though. All right, another myth. I love this one. My doctor will tell me when it's time to discuss hospice care. I have met very few doctors in my life who became doctors looking forward to having that conversation where they tell somebody that there's nothing else they can do. And a lot of them are not comfortable having that conversation. And that's okay. They're not really trained to have that conversation. So they struggle to broach the subject with you. I always tell people, if you think that at some point you're going to want to have hospice care when it's appropriate for you, go ahead and tell your doctor now. If you tell them that you want them to have that conversation with you when the time comes, that opens the door and makes it easier for them to broach the subject when the time is right. And it puts them in a position where they're no longer feeling like they're telling you there's nothing else I can do. And instead they're telling you, I can't fix this, but I can offer you hospice because I know you've told me you want that. That's an easier conversation for most providers to have. All right, when should I discuss my wishes with my family? Now. That's the short answer. Most of the time when we have people come into hospice care, I'd say probably 60 to 70% of the time at least, the person who is entering hospice care is not the one making the decision. And so we might think, okay, I know I'll choose hospice care when the time comes for me. You might not be able to be the one in the decision-making role at that point. So it's important to talk to anyone who might be involved in making that decision for you. Your healthcare power of attorney, your spouse, your children, not just one child, not just the one who's on the paperwork, but all of them. Because if you talk to the one child who's your healthcare power of attorney, and then the other kids argue with them because they didn't hear it from you, that's a tough position for them to be in. Just, blast it out to the world. Tell everybody. Anybody who might be involved in that conversation. All right, this is completely unrelated, but we're to the end of my presentation. So another helpful service that Four Seasons does offer that some folks on the Deerfield campus have accessed is care navigation services, which is, they say, providing support and guidance for individuals and families as they navigate the aging journey. These are folks who can help you with your healthcare decisions, go along with you to your doctor's appointments, be the extra set of ears when you go to the doctor and be able to report into your kids about what was said, help sort of translate that journey and coordinate those conversations. It's a completely separate service from hospice, but it is something that's offered that I have seen be helpful at Deerfield. And that's all I got, guys. I went quickly this year. So now I'm going to open it up to questions. And there may not be a lot of questions here because, full disclosure, I know a lot of y'all already. So what do you got? I see a hand. Steven's got the microphone back there. He's going to come running. I love making him run.
It's fine. My husband was recently at Mission, and he died at Mission. And
sorry.
They do not have hospice at Mission. They have their own, I think they call it palliative care, but it is not hospice. And I think that's a real shortcoming for going to Mission.
Most hospice care is provided in a home care setting rather than in a hospital setting. Often people at Mission will be offered the option of hospice care, not to receive it at Mission, but to transfer from Mission either to the Elizabeth House or home with hospice support. But I do think there are times when the providers at Mission, depending on who your provider is there, don't have that conversation when they should. Yeah, it's frustrating. And I'm sorry. Run, Stephen, run. He's not going to have to go to the gym later.
2 questions. 1, where is Elizabeth House? And 2, do you find that any of your patients are allergic to morphine?
2 good questions. Elizabeth House is in Flat Rock, so Hendersonville area. And it is very rare to have a true morphine allergy, but it does happen. Technically, an allergy to morphine would be someone who develops like a closed airway or something like that. It's not uncommon for some folks to have unpleasant side effects from morphine, like nausea or itching. Usually those will resolve within a few days. And we can just treat those side effects for that few days until they resolve. But there are other opioids we can choose to use instead. Oh, question is, what's my caseload here? It runs from, on the very low end, maybe 13 up to low 20s on the Deerfield campus.
Not a question so much as a little bit of a testimonial. 6 or 8 months back, my wife fell during the middle of the night. I believe it was a weekend. And she split her head open pretty badly. And the attending nurse here at Deerfield, who was very good, first was rather young and inexperienced and called for an ambulance immediately. They also fortunately called me. In any event, for various reasons, she did not want to go to a hospital and should not have been taken out of that issue. I called the hospice nurse who was there in about 35 to 40 minutes. She was a very seasoned pro, and she made the right call. She basically said, you made the right decision, because I turned the ambulance around. And all I'm trying to do is attest to the ability of the seasoned people that you have on staff. Thank you.
Thank you. And, I think kudos to you for advocating for your loved one's wishes, because that's not always easy in that situation. And you did a really good job with it. It's hard to be the one making the decisions for someone else, right? That's not an easy position to be in. And so hopefully if we're doing things right, we're making those conversations a little bit easier.
2 questions. In that situation, can you eliminate Deerfield medical staff and just deal with the hospice staff? And the second question is if your body is giving up, might not be through cancer or some other thing, and you don't want a feeding tube, is there medication? I don't know if there's any pain involved in it, but can you get hospice care for any pain that you might get at that point?
2 good questions. Okay, so the first question, can you eliminate the Deerfield medical staff? That is a challenge if you're talking about skilled nursing, simply because, again, Medicare has regulations that in any skilled nursing setting, patients have to have these regulatory visits that generally the only doctors who will do those are the ones who work in those facilities. So it's virtually impossible to completely eliminate the Deerfield medical staff. I think very highly of the doctors who function in skilled nursing here. I find them very collaborative and open to working with hospice and very receptive to a collaborative approach to care, more so than I've experienced anywhere else. As far as the question of declining a feeding tube and treating symptoms associated with that, yes, there are medications that can be given for any symptoms that come up as someone as your body winds down from lack of nutrition from not having a feeding tube. It can be handled through hospice care, yes. Whoop. So I asked them, well, if they decide she needs to have an IV with fluid because she's gone real natremic or she's become very dehydrated, I do not want it. Well, Jan didn't want it. The discussion I had with the nurses at Skilled was, okay, who gets to make the decision? And the best answer we came up with was put her on hospice so the hospice doctor gets to. It's because I did not want an intern or a new resident at Mission to decide that he didn't know what the fuck to do, so take her by ambulance, which is what they did. I mean, usually.
Yeah.
So that's when I decided, and she agreed that she should go on and hospice. That seems like an appropriate decision to me. I mean, if you know that your goals are very comfort focused, and the hospice providers are the ones who are specialists in comfort focused care, then they're the ones you want.
Or could you, for argument's sake, like the gentleman before us, can you have a notice in your room, say on the back, don't call an ambulance
You
Till-
can.
till hospice or you are contacted?
Yep. And I have put that order on a chart before.
And the most form has no, don't take to the hospital as well. So just
Yeah, the most form though says don't take to the hospital unless comfort needs cannot be met in place here, and that can be open to interpretation. So sometimes we'll add on to that. Don't take to the hospital without calling hospice first. And that way hospice gets to make the call based on the situation.
Can you explain the difference between palliative care and hospice care?
Excellent question. The difference between palliative care and hospice care. They say that all hospice is palliative care, but not all palliative care is hospice. So palliative care as a separate standalone resource is a consultative specialist for symptom management, usually for chronic disease. So whereas hospice is for end-of-life care, palliative care might be for someone who is in cancer treatment and needs help with managing their symptoms that they get from both the cancer and nausea related to chemotherapy or something. Or they might have chronic heart disease and shortness of breath, and palliative care might see them for that. Palliative care you would see just like any other specialist. So just like you would go to your cardiologist or your pulmonologist, you would go to your palliative care specialist, or here they might come to you. It would be once every few weeks, address your symptoms, tweak your medications, visit again a week or two later to see how that has helped. Whereas hospice care is going to be this sort of more comprehensive, holistic, around-the-clock availability for support, and rather than just being symptom-focused, it's whole person-focused. Did that make sense? Okay.
Do we have any final question? There's still a chance to be last.
Questions, comments, rude remarks. Bring it on, guys.
In which case, it's time to thank Macon profusely for her annual appearance, explaining the myths of hospice.
Thank you all for staying awake.
And also remember, she and her team are a phone call away. If we have ignorant questions, knowledge always cures ignorance. And Health and Wellness thanks you all for attending. And Macon will be here for a bit until the audience loses interest in asking questions. And we have a chaplain presentation towards the end of April in the series. Once again, thank you all.